Hello, and welcome to this web videocast from the Reproductive Science Center of the San Francisco Bay Area. I'm Dr. Carmelo Sgarlata, reproductive endocrinologist and fertility specialist. Let's talk about a very common obstacle to female fertility. Here at the Reproductive Science Center, we've seen thousands of women suffering from polycystic ovarian syndrome. PCOS, as it's often called, can cause upsetting changes in the way you look and, more importantly, problems with your ability to become pregnant. If it's left untreated, over time it can contribute to serious health problems such as diabetes and heart disease. PCOS affects up to 1 in 10 women, and often the symptoms begin in the teen years.
Right. The PCOS was, a difficult thing. I know a lot of women have it, and you just have to, persevere and keep trying. And I thank God for the medical knowledge that they have and the technology that they have available today, because I always have felt if I'd been born, in another time, in a few generations prior, I wouldn't have the family I have today, no question.
So what is exactly PCOS? Women with PCOS usually have a normal uterus and fallopian tubes, but their ovaries sometimes contain many small follicles or cysts, which are visible in ultrasound images. The eggs contained in these follicles don't grow normally. Each month, new follicles develop and shrink into cysts. The cysts produce androgens, which are hormones that lead to an imbalance in the woman's entire system. This imbalance can affect her ability to conceive and can lead to conditions such as diabetes and high blood pressure. The primary cause of PCOS-related diseases stems from worsening of an imbalance of hormone levels. The word used to describe PCOS is hyperandrogenism, meaning that a woman with this condition have elevated levels of the two male hormones, serum testosterone and androstenedione. In turn, the hyperandrogenism suppresses ovulation and the production of healthy eggs for fertilization. The symptoms of PCOS vary widely from woman to woman. In addition to polycystic ovaries, they can also include irregular absent periods, excessive facial or body hair, male pattern hair loss, obesity, acne, skin tags, brown skin patches, and exhaustion or lack of mental alertness, as well as decreased sex drive. Other less visible symptoms may include high blood sugar and high cholesterol. One of the complexities of PCOS is that the symptoms vary widely, and not all women display the same or all symptoms. For this reason, PCOS is often misdiagnosed. Women with family members with PCOS or type 2 diabetes are considered at higher risk for PCOS. So it is important to communicate your family health history to your physician. Also, if you don't have a period or more than 6 in any 12 months, you should see a doctor because PCOS might be a possible cause.
They have more knowledge in the area that you're going to need help with. He made the initial diagnosis of PCOS, showed me that strand of pearl look that your ovaries get when you're stimulated in a cycle, and at that point he made the referral.
Unfortunately, there is no cure for PCOS, but there is good news that the symptoms can be treated. Patients can learn to manage the disease just as they would any other ongoing medical condition. For example, symptoms such as male pattern hair loss or acne, which may not be health-threatening but certainly can be stressful, will often respond well to specific prescription medications to lower androgen levels. Treatment can definitely improve the chances of conception and reduce the risk of diabetes or heart disease. Making lifestyle changes, especially nutritional and exercise habits, is certainly a critical part of treatment. A key to reducing the symptoms of PCOS is the lowering of insulin levels, which can often be achieved with medications. Any diet or physical activity that also improves overall health will considerably affect a woman's hormone levels and reduce her chance of PCOS symptoms. Currently, it's all but impossible to prevent PCOS because we have yet to find a way to determine which girls may develop PCOS. However, family history of obesity, diabetes, or infertility can be important indicators. The earlier a woman is diagnosed and begins managing PCOS, the less likely she will to develop the long-term complications of infertility, heart disease, hypertension, and diabetes. That's why it isn't very important to tell your doctor about symptoms. Then if PCOS becomes a diagnosis, following treatment plans will help manage the disease. One treatment for women who are not trying to conceive is a hormone therapy through birth control pills or other hormonal contraceptives. All the PCOS sufferers, regardless of how much they want to get pregnant or lose weight, will benefit from a healthy lifestyle of regular exercise and good nutrition. As with many medical conditions, knowledge is a very important tool in treating PCOS. To learn more, please click on the link in your browser window to Podcast to download an audio recording with more details. You can also learn more by pointing your mouse at the button For Patients at the top of any page on this website, and then on Infertility Explained. Then clicking on Common Causes on the far right, or simply type the word PCOS in the search box at the top of any web page.
Oh, anyways, yeah, it was a full circle moment for me because I have driven here so many times by myself and left by myself, and for blood tests, doctor's appointments, ultrasounds, consultations. So today to drive up and have 3 kids in my minivan, pretty special, pretty amazing.
For everyone here at the Reproductive Science Center, thank you for spending time with us to learn more about PCOS.